Dr. Priscilla Imade is unavoidably engaged on another assignment, but we have a very capable hand on deck today, talking about none other than Dr. Rashidat Aruna. He's here with us on the show to take us through today's topic. So, ladies and gentlemen, boys and girls, mommies and daddies, let's welcome our doctor. Yes, October, Dr. Rashidat Aruna. Happy New Month.
Thank you. Happy New Month.
Yes.
Happy New Month.
I wanted to say October. Happy New Month.
Thank you.
Yes, it's a big month for eye care worldwide. So, of course, I'd like you to just, for those who perhaps do not have a clear understanding or a clear idea of why this is so, just walk us through why this is so, and give us a brief insight into this year's theme, Love Your Eyes. I know it was still seen last year.
Yes, so I think for the past 2 years, we've had basically the same theme, okay, but the variation was that 2 years ago it was loving your eyesight in your place of work, and I think last year was about kids loving their eyesight, and this year is just love your eyes for the year 2025, right?
Love your eyes, simply put, your eyes.
Love your eyes.
Okay.
So, and in the month of October, the second Thursday of every October annually is set aside by the international organization, the Agency of Avoiding Blindness Prevention.
Yes.
So they set every second Thursday of the year, right, of the month of October for World Sight Day. And it said Love Your Eyes for this time around, right? So why should you love your eyes? Why does your eye really matter? I think everybody should ask themselves this very pertinent question, and my reason may be different from the next person's reason, but your eyes are very important. They're very important because they're the means by which you can see the world, the means by which you can appreciate things, appreciate everything around you, see people's faces, do everything you need to do. And if you don't take care of your eyes, or if there's a problem with your sight or with your vision, you won't be able to do so much. In fact, a lot and every aspect of that individual or anybody will be affected, greatly affected, right? So people talk about health, right? Doing health checking your health. When people talk about that, they think or focus majorly on other aspects of their health, which I'm not saying it's not important, maybe your heart or your brain or your lungs or your liver. Yes, they overlook the eyes. And without your eyes, you really cannot function and go about doing your activity independently. And when I say independently, I remember that Nigeria had independence.
Happy Independence Day.
Happy Independence, okay. So in order for you to independently do your activity, carry out your daily tasks, you need good vision, you need good, healthy eyesight, right? And so the eyes, like I said, can be overlooked. So we encourage everybody every year, when you're doing your health check, also do your eye check, right? Because
most people, when they go do the checks, they do the vital,
check your kidney, check your liver, check every other thing apart from your eyes. Why? The eyes are important. The Bible says the eye is the light of the body, right? If the eyes is gone, total darkness, and it's really, really very scary, because I've encountered lots of people, they cannot see, and they can give everything, to get their eyes back, but nothing can bring it back. So if you can prevent that, why don't you prevent it? And you can do so by loving your eyes, okay? So loving your eyes does not need so much, right? Does not need anything dramatic or anything big. All it needs is for you to acknowledge the fact that your eyes are important, very, very important part of you, part of your daily activities, part of your existence. And imagine that every day we wake up, right? You don't forget to wash your teeth.
Of course.
If you can do that to our teeth, okay, why not just put the same, but more importance to your eyes? If you can take care of your eyes every day, the way you take care of your teeth, I think 50% of avoidable blindness can be addressed that way. And the statistics out there, they are very scary. I'm going to go over it later on. Okay, so we get to see that a lot of eye diseases that causes blindness can be prevented or managed, yes, if you do see as simple as a simple eye test, simple routine eye checkup, yearly eye checkup, right?
Talking about eye checkups, what's the how should it be? Like, what's the how many times? Like, how often? That's the word I'm looking for. So in a year, what's the how often should we do it? Is it once a year, twice a year?
Okay, so usually we advise that once in a year at least you check your eyes.
Okay.
Now if you have issues that needs to be addressed or that needs to be monitored really, really closely, then you go as often as you are given appointments. Some people have to go as often as every month. Some people have to go as often as every 3 months, every 6 months, depends as the case may be. But at least once in a year, check your eyes. And if you are the type that use glasses, okay, to correct maybe a refractive error, then your glasses should be changed at least every 2 years. I've had people that can use their glasses, that same glasses for 5, 10 years, they will not change it.
It's now the glasses now a family member.
Seriously, I tell them put that glass in the museum, it has served enough. Change your glass at least every 2 years because lenses also expires.
That is sentimental attachment to the lens. Maybe when they were using the lens, some sort of good fortune came their way, so you'll be like,
maybe it's the glasses. Maybe, but change the glasses.
You can still use the frame though.
Yes, if the frame is okay.
Yeah. So, dear listener, you can still use the frame or change the glasses.
Change everything as well.
All right, can we just take a look at the traffic situation? Let's see. I have this one from the Jigwe Apapa axis, where movement of vehicles from both Ojo Road and Oto Wharf to Ajeremi is good to go at the moment. Likewise, from Ballet Street to the Boundary Roundabout, it is looking good. Boundary Roundabout still cool and calm at the moment. Under the bridge, total, that's under the bridge of Total through Navy Junction connecting Naval Dockyard is good to go. Mobile Road in and out, very good. High Bridge, Ijara Lokba Ramp to Total Up Bridge down to Danlami, also very good on both sides. Vehicles coming out of Apapa from Point Road through the Marine Bridge to Igomu also have it very good. No impediments at this time, and we have the traffic managers stationed there doing their bit to make sure things move as smoothly as possible. It's all about loving your eyes. The month of October is all about your eyes, your eye care, and of course World Sight Day still in this month, and World Sight Day, the theme is Love Your Eyes, and Dr. Rashidat Aruna has been taking us through that journey, giving us reasons why we need to check out, make sure our eyesight is so important. And yes, so Doctor, I'll be handing this back to you.
Right, thank you. So the next thing I want to talk about is why the eye health matters, right? In our everyday life, our everyday activity. Why does your eye health matter? It matters because you need it to interact with the world. If you cannot see, you cannot see properly, you cannot interact with the world, you cannot appreciate the things around you, the nature and every other things you need to do. Without your vision, you can't do such. So it matters, right, in that regard. Now, secondly, in order for you to perform your daily tasks, for instance, recognizing faces and then reading, driving, working, whatever it is you are doing, whether you're a farmer or you are working in an office or you're in a factory or you are a welder or whatever it is at all, right, you're doing, you need your eyes, right, to be able to perform that activity, that task. Okay, I've seen people come into the clinic and they say they cannot see. I can see. They say, doctor, I can see you, but I cannot see your face very well. They cannot recognize faces. Although they can appreciate shapes, but they cannot recognize faces.
What could be the cause of that?
So most of the time they have either age-related macular degeneration or they have moderate to severe matured cataract sort of. So sometimes glaucoma as well, right, just takes away the sight and nothing can be done sometimes, right? So in order to not get to that stage, just love your eyes, right? Love your eyes by going for an eye test. Now, your eyes matter because they help you to be safe. How do I mean? You are working in a factory and you have good vision. You can prevent some sort of factory accidents, or you can prevent accident from operating machines or heavy gadgets, right? Some people that are into sports, right? You are able to do your sporting activities really well, preventing accidents and being safe. You're safe and others around you also, they're safe, right? So your eye health matters in that regard. Now, if you have good sight, of course, your quality of life will be very good. How do I mean?
How do you mean?
How do I mean? So if you can see, you don't have to depend on people to be able to do things, right?
Okay.
You're happy. You can carry out any activity you need to do, and you can see you can perform any task. You can go about doing anything you want to achieve, right? You don't need to depend on anybody to go where you want to go to. You don't have to wait. I've had, like I said earlier, I've had encounter with people that they cannot go anywhere. They can't even come to the clinic to do an eye checkup because they need someone to bring them, and if that person is not free, they can't go. You understand that restriction, that's not being able to see gifts. But once you can see, you are independent, you can go wherever you want to go, however you want to go, whatever time you want to go, and it is something that it's really underrated, right? So, but if you can't do that because you don't have good vision, then that's very bad. So having good vision helps to increase your quality of life. Now it helps also when you have good sight, your mental health will be very good, right? If you cannot see, you get depressed, you get anxious, you don't know what is coming at you, you don't know who is beside you don't know where you're going to, you're afraid of tripping and falling, you become depressed and anxious and worried, and that affects the mental state. Like I said, I've had encounter with so many people in that condition. So that's why you need to really maintain your eye health. Very important, right? And a routine eye examination can go a long way to help you detect serious eye problems, serious eye diseases, right? So issues like your blood pressure, like diabetes, like high cholesterol, even as far as even a brain tumor can be detected by a routine eye examination, because the eyes are connected to the brain. It's an extension of the brain. So if you carry out an eye examination, if there's a problem, for instance, we see maybe some blood on your retina, or we see some scars or degenerations on your retina, we tell you, we ask for other tests, and we find out that some of these people, they don't even know that they have very high sugar level. Like their sugar level is so high, and that's what's affecting their vision, making their vision blurry. They start developing cataracts, cloudy sight. Cataract induces glaucoma and every other, it's like a progression of eye problems. But which one eye checkup can prevent, can avoid. So love your eyes by going for an eye examination, right?
Oh, doctor, just let's quickly, of course, we should take calls this time. Let's just see how we can take your calls. If you want to reach out, if you have any eye question, eye concern, it's the month of October, and World Sight Day is coming up pretty soon in this month, and of course the theme is Love Your Eyes. 091-538-77127. Yes, if you have any question, or you just want to, if you want clarity as about any eye challenge, or perhaps that of your child, your ward, or your spouse, or whoever, feel free to connect with us. Or maybe it's just about your sight. Feel free to connect with us. 091-538-77127. And yes, Dr. Rashidat Aruna, take it away. Even as we keep, you were saying you were going to give us some statistics.
Yes,
okay.
So I'm going straight to that.
All right, let's do that.
So there's a striking fact that most blindness in the world could have been prevented. That's according to Global Health Organization.
Let's just hold that thought. We seem to have a call. Hello.
Hello.
Yes, welcome. Your name and location, please.
Yeah, thank you. Jerome Akpan is my name.
Jerome Akpan from Ikeja. Okay, please go on.
Yeah, please. I want to find out from the doctor.
Okay.
I'm having some issue in my eye. Sometimes water comes out.
Okay.
Water just comes out.
Sometimes water comes out.
Yes.
Okay.
If I'm lying down or if I'm in the house,
okay,
it's a double water from my eye.
Okay.
So I want to know what sign is that is.
Okay. Let's just allow the doctor respond. Do you want to stay on the line, or you would listen through your radio?
Let me stay on the line in case of question.
Okay, doctor.
All right. Thank you for your question, sir. So, in my experience, the common issue most time for that is if there's dry eyes.
Dry eyes.
Yes,
okay.
if there's dry eyes. So if the tear layer is not, it depends on the age. So,
okay. So how old are you, sir?
Okay.
How old?
42.
42. Okay.
Yes. So around that age, right?
Yes.
You start developing some dry eye. For some people, right, it's their activity.
Activities. Okay.
If you spend much time on screen, he said whenever it sleeps and all of that.
Yes.
Then systemic issues like diabetes can also make one have tear up. I've seen it in my experience as well. Yes, but most common causes, if there is a compromise in the tear layer, which is dry eyes. Yes.
Okay.
And we have, in fact, dry eyes is a multifactorial disease.
So what can he do about it?
So it needs to go for an eye
examination. Eye check. Okay.
So it will be diagnosed if it's dry eyes.
Yes.
You'll be given medications
to use. So Mr. Akpan, I hope you got that. I hope that has helped.
Then you should check your systemic health.
Yes. So just get your eyes checked. Come get your eyes checked. You can even come to Modern Eye Care Foundation and get your eyes checked, and of course they'll take it up from there. Thank you very much for calling. Do have an amazing day. Yes, the remainder of the day, of course. 09153877127. Yes, final few minutes of the show. Dr. Rashidat Aruna was giving us some statistics. Please.
Okay. So, according to Global Health Organization, right, at least 75.
We have another call. Let's just take this. Hello.
Good evening.
Good evening. Welcome.
Happy New Year.
Same to you.
Doctor, God bless you.
Good evening, sir.
Doctor, please, I want to ask, nowadays now, people are not going to hospital now, but because of the money that is maybe based on their sickness and the money, as for them now, they prefer, maybe they are doing any free health care, which they can take, but those medication keep increasing. So how are you going to help some people now in such situation now? Because most times too, some people, they don't like checking their health, because when they go there, at least 10,000 don't come out. Whereas the drug that they have already ordained for you have not paid the drugs. So how are you going to help such people at the moment having a similar issue like this? Thank you.
Thank you, Sixtus.
Thank you. No, it's a very important question.
Yeah, very valid.
Very valid question.
Yes.
And in Modern Eye Clinic, we have a foundation, right? We try to subsidize health for checking your eyes for people that are in such categories. So we have all that. And then I also ask, the cost of blindness is
side by side
way more important. It's way more. What do you call it?
It's way more expensive,
right? It's more expensive. It's more costly because at that point in time, you don't even think about the money. You will give all the money that's asked, right, in order to get your sight back. So there are some things that are very important, and it's not like you're going to be checking your eyes every day. Just sacrifice, do your check, be sure that you're okay, and then go about your other activities. And like I said, in Modern Eye Clinic, we have a foundation that subsidizes eye test for people that financially constrained to
make full payments.
Yeah, exactly.
All right, our statistics before as we wind down on the show.
Okay, so I said that already. Globally, we have 2.2 billion people that live with some form of vision impairment.
2.2 billion.
2.2 billion, and in this 2.2 billion, at least 1 billion of these cases could have been prevented, right? Imagine that, and that's based on World Health Organization statistics. And more than 90% of people affected live in low to middle income countries. I think Nigeria falls in that category. So imagine that 90% of these diseases could have been prevented, could have been avoided. 90% of blindness could have been avoided by just simply doing an eye examination. And like I said earlier, cataract still remains the number one leading cause of vision impairment in the world. Yes, and it's responsible for 94 million cases of moderate to severe impairment. So 94 million people has cataract. I'm sure the figures are more, right? So, and this is avoidable. Is avoidable by a simple eye test and surgery or medication, as the case may be. Uncorrected refractive error. This has to do with glasses. Roughly 88 million cases, right, of distance vision impairment are caused by lack of glasses and contact lenses. I mean, with the simple glasses, you can see if you have myopia or you have hyperopia, that's long-sightedness or short-sightedness. It can be corrected with glasses. And up till now, I still hear some people, they still have that wrong myth that is you cannot wear glasses. I will not let my child to wear glasses. I will not wear glasses. It will make my eye worse, or it will make my eyes go in, or whatever the reasons why they refuse to wear glasses. Not putting on your corrective lenses at the right time, as earliest as possible, can result to complications, right? Amblyopia is there in cases for children. They can develop amblyopia, whereby the glasses will even correct them to the full limit of good vision, and it can impede or affect that child's learning or that child's education. So I encourage parents, encourage everyone, if your doctor tells you need glasses, please go ahead and do the glasses. Glasses does not make your vision worse, doesn't affect your vision in any way, unless you're wearing the wrong prescription or you're wearing the glasses that's not yours. So use your glasses, have good sight, so that your eyes and your brain can interact, in the right way, interpret vision correctly, and you can make good judgment and live, life. How do you call it? Right, and then presbyopia. Presbyopia has to do with reading. Okay. So when you get to the age of 40, most of the people, they will develop reading issues. All you need to do is go to your doctor, maybe examine and giving the right prescription for reading. Glaucoma, we talk about glaucoma, we talk about age-related macular degeneration, diabetic retinopathy, all of these things. I said last time that a patient was asking me, how does hypertension as it related to the eyes? You have blood vessels in your eyes. Blood is being supplied to your retina. You understand? So if your blood pressure is not properly maintained, it affects the blood vessels on your retina, which if the blood leaks on your retinal surface, it can cause blurry vision, and most of the time it will not be reversed. Glaucoma, irreversible vision loss. When you talk of glaucoma, you talk of irreversible vision loss if it's not properly managed. So I encourage you, everyone, there's a lot to be said, and in this month of October, we are all about loving your eyesight. So by next week, we're going to do Love Your Eyes, right? So just listen to us, and if you have any questions, you can ask as well.
All right, it's been a great time on the show. I leave with this parting thought. To neglect your eyes is to compromise your safety. Please think about that. So you need to prioritize regular eye examinations. Act promptly on any change you notice about your sight, and above all, like the theme for this year's World Sight Day, love your eyes. Now, if you missed any part of today's show or past episodes, you could always catch up via our Facebook page, Lagos Traffic Radio 96.1 FM, or our YouTube channel, which of course is Traffic Radio 961. Just search for the keywords eyes. Pardon that, eyes on the road. Dr. Priscilla Imade, OD, MSc, PhD in Public Health, is a consultant optometrist at the Modern Eye Care Foundation and a fellow of both the American Academy of Optometry and the Nigerian Optometrist Association. I must say a very big thank you to Dr. Rashidat Aruna, taking time out of her busy schedule, to come give us this very, very, very valuable priceless nuggets as regards how to, take care of our eyes and why we should love our eyes. Okay, so for more inquiries, of course, if you want to go visit them at the clinic, it's about 16 to 18 Ogunisi Road, opposite Omole Estate, Phase 1 by Akyode Bus Stop, which is Berger. Or you can call 080 33 6672. That's 080 33 6672. On behalf of the production team led by Micah Arocha, with assistance from Adeleke Toluwalashe, our executive producer is Tayo Akonle. I am Akan Usen. Eyes on the road, your safety, our priority. Lagos Traffic Radio 96.1 FM. See you next week.